Hey guys.
Hey.
So we're gonna do a little bit of math first, probably. So I'm just waiting for everyone else to get on here. But we'll do that, and it's just gonna be like a practice math test, like we did, earlier on in the term. It'll be something like that. So because everyone passed the math like right off the bat, no one had to take, B, dosage calculation B. So we'll just do that together and see if we can get the hang of that. And then we'll get into a little bit about the fundamental stuff so that you guys can start preparing for that. So do you guys have access to your fundamentals ATI book right now? Like, can you get it so you have it if you don't have it right next to you?
Wait, which one is it? The newest one or the older one?
It's the gray one.
Okay.
It'll say fundamentals for nursing on the front of it.
Yeah. And then I'm sorry, but since I got on a tad late, are we doing the math first?
Yeah, we're going to do some math first.
Okay.
I was just waiting for more people to get on here before I started. Hey, Vera.
Hi.
All right, let me see if I can pull this up.
No.
All right. Can you guys see this?
Yeah.
Okay.
Yeah.
So this is actually going to show you answers, but I kind of want to just show you some of these questions so you can like maybe write them down and try to do them, and then look at the answer. So we can do some of these together. So this is just like what we did at the first part of the term when we took the dosage calculation exam. This would have been exam B if anyone needed it. So remember the first so many questions were just conversions. So do you guys have paper and a pencil that you can write some stuff down?
Yeah, I'm about to go get mine right now.
Okay. Well, if you don't have it, go grab it real quick and then we'll keep going here. So on your next test, there's going to be 4 math problems. And I think there's 2 of them that are going to show a medication label, and then the other 2 will not. So like, the ones with the medication label, you typically have to look at that to be able to figure out the answer, So I believe we'll have a couple like that on here. All right, so why don't you guys write these down real quick? So there is, and actually, I'll just tell you these and I'll stop sharing for a second so you can just figure these out real fast. So for these conversion questions, there was one that was 3 milligrams equals how many micrograms? So write that down. The second one was 10 milliliters equals how many teaspoons? The third one is 0.8 grams equals how many milligrams? The fourth one is 187 pounds equals how many kilograms? And then the fifth one is 0.125 grams equals how many milligrams? And then the sixth one is 500 micrograms equals how many milligrams? So see if you can figure those conversions out real fast, and then we'll keep going with the other stuff. All right, who's done with those?
I am.
Okay, what did you get for number 1? 3 milligrams equals how many micrograms?
3,000.
3,000?
Yeah.
Okay. All right, what everyone get for number 2? It was 10 milliliters equals how many teaspoons?
It's 50.
50.
Wait, what is it?
50. 50.
No, it's not 50.
It's not.
It's
Wait,
2,
10
right?
milligrams
2.
equals how many
It's 2.
teaspoons?
It's 2.
Yeah.
Remember, 1 teaspoon equals 5 milliliters. It seems like that's
Yeah.
always a hard one for people to remember for some reason. And then for future reference as well, think about when you're cooking and when you have like, you know, your measuring spoons and stuff. That's how I remember it. If I look at those, I'm like, oh yeah, you know. So you always know that your teaspoon is smaller than your tablespoon, like when you're cooking. So if you know the 1 teaspoon is 5 milliliters, then how many milliliters is 1 tablespoon?
15.
Yeah. So see, there's kind of a big difference there. Okay, what's number 3? 0.8 grams equals how many milligrams?
800.
800.
800, definitely. All right, number 4 was 187 pounds equals how many kilograms?
85.
85.
Oh, 85?
85
Yeah.
kilograms.
Yes,
Oh.
it's 85. So you take 187 divided by 2.2. And so if you ever get a conversion where it tells you kilograms to pounds, how would you figure that out? So like if I told you 85 kilograms equals how many pounds, how would you figure that out?
You'd multiply it.
Yeah, yeah. So 85 times 2.2. Okay, so number 5 said 0.125 grams equals how many milligrams?
125.
Definitely, good. And then the last one was 500 micrograms equals how many milligrams?
0.5.
Yes, good. All right, so you got those conversions pretty good. All right, so now we got to do a couple others. Okay, so listen to what I'm saying and you're going to write it down because I don't want to show you this because then you're going to see the answer. Okay, so Haley is prescribed a medicine called Geodon. And this medicine is 30 milligrams POBID. And this is given to her to manage her schizophrenia. So the pharmacy stocks 15 milligram tablets. So how many tablets will Haley need to take to give her morning dose?
2.
2, right? So remember the order's for 30 and you have 15 milligram tabs on hand. So if you take 2 tabs, you're going to have 30 milligrams, right? All right, let me see if I can just show you this one here. Trying not to show you the answer, but still showing you the problem. Okay, look at number 8 here. Oops, sorry. Let me go back down, darn it. Okay, there it is. Can you see it?
$1.4.
Is that what everyone else got? I'm just trying to give everyone a minute to finish the problem if they didn't do that yet.
Yeah, 1.4.
Okay, good.
Yeah, 1.4.
Good. So again, on your test, you're going to have two problems real similar because it'll have a medication label that you have to look at. So there's two like that. Let me see what this next one is. Oh, do you guys remember these ones? So this shows you the answer, but do you remember, so you have a certain amount of IV fluid and it tells you how fast it's infusing and it tells you what time it was started and it wants to know how long it's going to take it to get done.
Yeah.
You remember how to figure that out?
Yeah.
Okay, I'm trying not to show you the answer to the next one here. Okay, so now we have an order to infuse 1,000 milliliters of D5W in 10 hours by the infusion pump. How many milliliters per hour do you set your pump for? Do not round your answer.
100.
100.
Yeah. Okay, if you have vancomycin 2 grams in 100 milliliters of normal saline running at 50 milliliters an hour, how many milligrams per milliliter are in this piggyback?
$20.
Everyone else have a chance to figure it out or no?
Okay, so 2,000 divided by 100 will give me 20.
Is it 20?
Yeah, I agree with her. I think it's
1,000?
22.
20?
It's 20, yes. So how did you guys figure that out in case someone else doesn't know how to figure it out? What did you do first?
I took the 2 grams and I turned it into milligrams and then divided the milligrams by the milliliters.
Okay. Perfect. Okay, let's try this one. All right, this one has a medication label. Let me see if I can show you the whole thing without showing you the answer. Nope. I can't do it without showing you the answer. All right, so in this one, after recovering from a COPD exacerbation, your patient's being discharged home. You need to give education regarding taking prednisone 15 milligrams by mouth daily. If the patient receives the package below from CVS, how many tabs will you instruct him to take every morning? So that this tab, it says 5 milligrams are in 1 tab. So
3.
yeah, so 3 times 5 would be 15. So after what we talked about this morning in class, you know how when we talked about Addison's disease and we talked about corticosteroids a little bit, you remember in the one PowerPoint how it gave all those side effects? What would be some things that you would teach them about side effects, you know, that they would have from prednisone? What can it do to your blood sugar?
Can decrease it.
And increase
No,
it?
it's going to increase it. So it can increase your blood sugar. What can it do to your immune system?
Yeah, like
More
diarrhea.
susceptible for infection.
Yeah, it's going to decrease your immune system so you could catch things really easily. What did we say about like, what can it do to your bones?
More prone to fractures.
Yes. Is there anything else you can think of that we talked about with side effects? What happens if you abruptly stop taking it?
We can have the severe
Storm.
Addison's crisis.
Yeah, so it's Addisonian crisis. And so what kinds of things would you see?
Like increase heart rate.
Hypertension.
Uh-uh. So that's why I'm at. Don't worry if you're not getting it right. It's fine. I'm just trying to get you to remember some of this stuff. That's why we're talking about it. So remember, with Addison's disease, you have a deficiency in those hormones. You don't have enough of them. So some of your symptoms, remember the stuff that I was wanting you to really focus in on, remember you have low blood pressure with this because, yeah, so you can like pass out really easily. You also have low blood sugar with this. You have low sodium. So you have like this dehydration kind of a thing going on. That's kind of what you need to be thinking about with that. Okay? All right, here, we'll keep going. Oh, this is what I was doing with my other class this week. You guys remember how to do these? So Lucy is experiencing unstable bradycardia. So the nurse practitioner enters an order in the MAR. The order reads dopamine, IV push, 9 micrograms per kilogram stat. If Lucy currently weighs 86.7 kilograms, how much dopamine will she receive? And they want to know your answer in milligrams.
In milligrams. Did you say the answer was supposed to be in milligrams?
Yeah. So basically with these kind of questions, you always look at your weight first. And in this particular question, it's already in kilograms, so you don't have to change it. So then you usually take that and you multiply it by the other number, right? So 86.7 times 9. And then whatever you need to do to change that to milligrams is what you would do at the end there. So what everyone get? So this is what the answer is supposed to be, 0.78.
Oh, that's what I got. I just forgot to turn it into milligrams.
Oh, okay. Anyone else have an issue with that one, or you guys get it okay? And then there's one right underneath it that's pretty much the same type of question. So like in this one, this person weighs 318 pounds. So you're going to deal with that first. So you take the 318 divided by 2.2, and then whatever you get, you're going to multiply it by this 11. And then it says it wants it in milligrams, so then you're going to change it to milligrams. So it's, you know, it's up to you on when you want to convert. Like you could convert in the beginning if you want to, or you can just do it at the end. It's up to you how you want to do that.
Okay.
Did you get that okay?
Yeah.
Okay, good. All right, here's one. This is a time one again. So this person is receiving 800 milliliters of lactated ringers at 200 milliliters per hour. If the infusion is started at 3:30 in the morning, what time will it be complete?
$7:30.
Did everyone else take a look? I know some people do math quicker than others, so I'm trying not to reveal until everyone's done.
Yeah, 7:30.
Okay, good job. All right, let's see what else we got here. Okay, here's an I&O question. So in this question, you have 4 ounces of Diet Pepsi, 100 milliliters of ice chips, and what do we do with ice chips?
Half.
Half.
Cut it in half, right? 1 cup of cherry Jello, which how much is 1 cup in milliliters?
240.
240. 8 ounces of beef broth and 4 ounces of grape juice. So how many milliliters is all of this for their intake? What'd you guys get?
770.
Yeah. All right, and then this person, I think this type of question is what your other 2 questions will be like on your test. So like this kid is, he takes 2 pills every morning before school of this Ritalin that he takes. If the psychiatrist has prescribed 30 milligrams daily, how many milligrams are in each tablet that he takes? So it's basically 30 divided by 2, right?
Yeah.
So the other 2 are going to be real simple. Here's another one of these label questions. Try to do this one real quick.
$60.
6.
Is that what everyone else has?
I have 6.
Yeah, 6.
6.
Oh. Can you go up a little bit?
Oh, yeah.
Oh, yeah, I'm done. Go ahead. Thanks.
All right, how about, and this is another simple one. So this person orders for 600 milligrams POTID. How many milligrams of lithium is being given each day? You see how to figure that out? So if TID means 3 times a day, then that means that's every 8 hours, right?
Yeah. Yes.
So 600, divided by that, or times that, I mean, would be 1800. All right, and then here's the last one. Joshua was prescribed erythromycin as a discharge medication. Walgreens stocks the supply below. If he needs to take 215 milligrams of erythromycin liquid daily, how many milliliters will you instruct him to take? Round to the nearest tenth.
The 5.4.
Yeah, 5.4.
5.4. Good job. All right, so I just wanted to do a little bit of practice math with us. Every so often, it's always good to do that. Make sure you're still getting things the right way. Okay, so does anyone have their syllabus right close by that they can look at it real quick? I just want to know, what week is our fundamentals proctored?
I think after the exams.
Yeah.
So like 2 weeks?
Well, you said the proctored one or the B, fundamental B?
The proctored one.
No.
I think that is week. It's like the week right after the exams, after the final, right before the final.
The week before the final?
Yes.
So what is that, week 14 or something?
It's August 14th.
It's 15.
Okay. So it's week 15, you said?
Yes.
Okay. So we have quite a bit of time to prepare for this, which is great, because typically it feels like it's always really rushed. So I want to show you a couple of things that you can start doing now to get ready for this, okay? Because these proctored exams are no joke, and they can mess up your grade if you don't do well. So you need to really take this seriously and do good on it. Let me see if I can find. Yeah, I think this is what I wanted to show you. Okay, so on YouTube, if you just go to YouTube and you put in a search and you say ATI fundamentals, you can find this. So there is this girl over on the right here. I don't know what the heck her name is, but she does these videos on ATI fundamentals review. And she basically takes the whole ATI fundamentals book and she does some kind of video on, some of these chapters, just to review the content with you. So over here on the right, this is one she did on chapters 1 and 2. And you can keep going. There's a ton of these. So I think she's pretty good. I like the stuff that she does, and I think it's pretty helpful. So she has her own channel, I guess. I think it's called Heleva RN. So like this. So if you go in and look at her stuff, I think you should. I think it'd be really helpful for you. So one of the things that she does in these videos is this particular video here. she does like some ATI tips and tricks, which I think is super helpful. So if you don't watch any of those, and if you at least watch that one, I think that will help you a ton. And see, it's something like 12 minutes long or something, but man, she gives you a ton of stuff. So you guys remember when we went over test 1 for our class, and I was telling some of you about how you can look at the ABCs in a question and try and figure out airway, breathing, circulation. She talks about stuff like that in here too. And so she gives you a lot of really good information, and like you could sit there on your own time and like take notes or do whatever. So I would definitely use this. I think this would be really helpful for you. The other thing I want to show you, get out of that. Okay, so this is the Nurse Labs website, nurselabs.com, which I don't know if you guys have ever been here or not. It's okay. I don't love this website, but it is somewhat helpful sometimes. So what you would do here is if you go under exams, you always want to pick RN, right? So you go to RN. And then you basically have to really page down because there's a ton of stuff on this page. So keep going. And then eventually you will come to some practice questions. So look at this. So they have RN test bank for NCLEX right here, where there's, here's 40 questions. Some of them have 50, some of them have less. And those are just like of all subjects, right? Then if you keep going down, they break it down even further. So now these particular ones are just about nursing research. Here's some practice with select all that apply questions. Here's some practice with prioritizing, delegation, and assignment questions. They have ABG practice, nursing leadership, pharmacology. They break everything down, right? So eventually, as you keep going, here's fundamentals, right? So these ones here are just basic everything in fundamentals, right? So, here's 25, 30 questions, it varies. But then they even break it down even more, which this is what I like about this website, because other ones that you go to, they don't do this. So you know how when you take a fundamentals ATI exam, like when you did your practice ones, when they break it down on your one printout, they break it down into different categories like basic comfort and care, safety and infection, and all of that. Well, look what this does. So, hey, here's questions specifically about the nursing process. Here's stuff about safety and infection control. Here's stuff about basic comfort and care. So this is what I like, because a lot of times people don't realize what their weakness is, so once you do some questions and you see like where you don't know stuff, that's what you should be focusing on. So like after you do one of those practice tests, you should be like, oh, okay, it looks like I missed a bunch of them in basic comfort and care, so I'm going to do questions on that, So this is pretty helpful, I think. It has, a ton of different categories here that you can go through and quite a few different practice questions. So I think, we should probably do some of these together now. We can do that. But then, for future for you guys, when you go to other classes, there's other topics in here too that do the same thing. So here's maternal child, pediatric, med surg. So like for our other class. So, how we just talked about endocrine, you could go down through here and find endocrine right here. See, 50 questions. So whatever we're talking about specifically, you can kind of go in here and see if you can find it. And here's fluid and electrolytes too. So that might be helpful to do some practice questions that way. Okay. Have you guys ever been to this site before?
Yeah.
Yeah.
Okay, so let's do a couple of these fundamentals ones. So when you guys do your printouts, I think you guys probably don't do this right, because I think you guys probably take your quiz 3 million times before you turn it in, because a lot of you are turning in like 100% and stuff. That's not really what it's meant to be like. You're supposed to take it the one time, and then if you don't, if you get a 50-some%, that's fine. You turn it in that way, and it tells you what you're weak on. So which category do you think you guys usually might miss some things? What do you think? Look at these categories here. What do you think you would need more help with?
Probably patient tubes.
Okay, so like the NG chest and trach stuff.
Yeah.
All right,
Yes.
let's look at that one. Let's see what that looks like. So as you are doing practice questions, I would encourage you to just do it in practice mode, because this will show you a rationale for stuff, and hopefully you'll learn from some of your mistakes, So let's do practice mode. All right, so it says, which of the following is not true regarding types of nasogastric tubes? So let's think here for a second about what we know about tubes. So the main tube that we're all familiar with, is the double lumen tube that has the blue port off of it. That's what you guys should all have in your lab bags. So that's usually the Salem sump tube, right? They don't have that in here in our options, so we won't worry about that. The Levin tube is another type of tube that we know. It has one lumen to it. So look at what this says. Levin tube is a double lumen nasogastric tube with an air vent. Well, that's not right. And then Senstaken-Blakemore tube, that's another tube that you would put in if someone had a GI bleed. Like if they had, esophageal varices that were bleeding, you could put that in and inflate it, and it puts pressure on those esophageal varices to get them to quit bleeding. So what do you think is the correct answer here? And see, I don't even recognize these tubes. I don't know if that's even a thing, but I just know what I know, you know what I mean? So even like if you don't recognize something as an option, if you recognize the other stuff, that's fine. Just make sure that those things are true. Like think of it like a true or false question. Okay, so hey, here they're talking about Guillain-Barré syndrome. Remember we just talked about that the other day. So a newly RN nurse is about to insert a nasogastric tube to a client with Guillain-Barré syndrome. To determine the accurate measurement of the length of the tube to be inserted, what do?
C, nasal, symphoid, those kind of measurements.
It's B.
Oh,
So the tip of the nose to the tip, what's it say? By measuring the tube to the tip of the earlobe and then down to the xiphoid process. So tip of the nose, tip of the earlobe, xiphoid process. Yeah, see why this is wrong? This is saying like you measure
yeah.
the chin.
I thought that was what they had the, never mind. My eyes were seeing different things.
That's okay. All right, and then this one here, it says a stroke client who was initially an NG tube feeding, or they were initially on that, they were getting nasogastric tube feedings. They were able to tolerate a soft diet, so the physician ordered to take it out. The nurse would instruct the client to do which of the following before he removes the tube.
D.
B.
Okay, good job. All right, the nurse is preparing to give a bolus enteral feeding via a nasogastric tube to a comatose client. Which of the following actions is an appropriate practice by the nurse?
Elevate the head. D.
I think it's oh wait, just kidding, just kidding. No, it's not.
Is D, I think.
Yeah, because let's look at the other ones. So if bowel sounds are present, hold the feeding. Why would that be? We want bowel sounds. That's just showing us that they have, a good gut, that it's working. Assess the tube placement by aspirating gastric contents and check the pH level. Sure, that's a good thing to do. We like that. Warm the feeding to room temperature to prevent the occurrence of diarrhea and cramps. Yeah, typically you want it room temperature. You wouldn't want it super cold or super hot or anything. Elevate the head of the bed 45 degrees and maintain for 30 minutes after instilling the feeding. So you said D?
Yeah.
Yeah. So they say if the client's comatose, you want them really like sitting up well, so 90 degrees, because they're more at risk for aspiration. So if they were down at 45 degrees, you'd be worried about that more.
But then if they're like not comatose, the 45-degree angle is okay, right?
Yeah, I mean, technically, probably, as long as they're not flat, of course, we always want them to be up. I think they say, I want to say in the book, it's just something about 30 degrees at least or something. But yeah, you want them to be up, for a while, because that's the biggest worry is that they're going to aspirate.
Yeah.
Okay, so a nurse is checking the nasogastric tube position of a client receiving a long-term therapy of omeprazole or Prilosec by aspirating the stomach contents to check the pH level. The nurse proves that correct tube placement if the pH level is what? So think back to when we talked about acid-base stuff. What's a decent pH?
3.5 to 7.45.
Okay.
So if that's the case, check for the pH.
Oh, so it's gonna be D.
Blue placement.
Since it's like,
So you think D?
Yeah.
yeah.
Okay. So yeah, so I mean, I'm just saying think acid base because we talked about the pH then, maybe it would help you figure out what's what. So obviously if something is more acidic, it's coming from their stomach. So you would think of it that way. So gastric placement is indicated by a pH of less than 4, but may increase between 4 and 6 if they're already receiving acid inhibiting drugs. All right, before feeding a client, the nurse checks for residual and obtains a residual amount of 90. What is the appropriate action for the nurse to take?
D.
Yeah, so 90 isn't very much. So I've had people in the past, they're like, well, why don't you just get rid of that? Why don't you just like squirt that in the toilet? Why do you have to reinstill it? Why do you guys think?
It contains a lot of nutrients.
Yeah, so they need all the fluid they can get. So if you're taking fluid away from them like that, you need to put it back because typically they're not getting enough as it is. So a lot of times when people are getting tube feeds, you have to give them water in between too because they can get dehydrated. They don't get enough because they're not taking in enough. So anytime you do a residual, you should always put it back in. Okay, continuous type feedings is administered over a blank hour period.
B.
It has to be 24 hours.
Yeah, I would think it's 24. So if it's continuous, you're constantly giving it, right? Yeah. Okay, a client is subjected to undergo a chest x-ray to confirm the endotracheal tube placement. The tube should be how many centimeters above the carina? Which I don't know if you'll know this. I probably would never know this either. So just make a guess, it's okay.
Isn't B and C the same?
Yeah, they are.
So maybe one of them.
So
Yeah.
yeah.
Just make a guess.
BSC.
Look,
Oh,
so we are right, but yeah, that's so stupid. Someone screwed up there. Okay, after the client had tolerated the weaning process, the physician ordered the removal of the endotracheal tube and will be shifted into a nasal cannula. Which of the following findings after the removal requires immediate intervention by the physician?
C. Definitely. Since they are coughing out blood.
Yeah. Okay, the nurse is assessing a client with an endotracheal tube and observes that the client can make verbal sounds. What is the most likely cause of this? What do you think?
Is it B?
Yeah, good job. So usually you're not supposed to hear anything, you know, when they have it in and it's in the right place and it's not having problems. So, yeah. Okay, while changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. What is your initial action? What should you do?
I don't know.
What do you think?
Honestly, I think A or B.
Which one do you want me to put?
I would say
Couldn't the nurse do it herself?
I mean, the nurse can do it herself too.
So this is what they want you to do. So they don't want you to just shove it back in. So if the tube is dislodged accidentally, the initial action is to grasp the retention sutures and spread the opening because you're worried that this opening is going to start closing up. So typically, like when someone has a trach, you have certain things at the bedside in an emergency situation like this. So sometimes they'll even say if you have, the heck do you call those? You know, the clamp, the heck is that? So, you know, it looks like scissors, but it's not. It clamps things closed. What am I talking about with that? What is that called?
I know what you're talking about, but I just don't know what it's called.
It's on the tip of my tongue and I can't think of it. But anyways, sometimes that's at the bedside and you could actually use that to like open up the site. So it says options A and C, calling the respiratory therapist and the physician will delay treatment. So you wouldn't want to do that because this is an emergency. So you don't want to just cover it because it's going to block the airway. So you see what I mean? So anytime you have a question where it's saying like you're delaying treatment, that's always wrong. So you have to think about it too with the trach, this is the way that they're breathing. So if you cover that with a dressing, they're not going to be able to breathe at all. So just think, especially if this is a new trach, they're just worried that that hole is going to go shut. So you need to kind of keep that open so someone can come in and put that back in. And you guys were asking if a nurse could do that. It depends on your facility and what they want you to do. So you would just have to be aware of what your facility allows you to do. Okay. Some places are going to say no. Some places will say yes. All right. So if you at least had that airway open, at least they could still breathe until someone came to help you, get that back in. All right, so for this one, I know we haven't done our chest tube stuff yet, but this says a nurse is caring for a client with a pneumothorax who has had a chest tube inserted and notes continuous gentle bubbling in the suction control chamber. What action is most appropriate for the nurse? So first of all, what's a pneumothorax?
A collapsed lung.
Yes. So let me try and draw this real quick. So if you were looking at a lung, the outside of your lung and like the inside of your lung, there's like a little area in between. Well, I didn't draw that very good, but like this little space in between, that's what I'm talking about, okay? So when someone has a pneumothorax, typically like this part here is your lung right here. And then this is the space in between like the outer part and the inner part of your lung. So you have what we call surfactant that's in here, and there's just a little bit of it in here in this space. If there's not a ton, but it's just enough so that when your lung expands and contracts, that it's not dry, like it can move back and forth without causing you a lot of rubbing and hurting, right? So when your lung collapses, it's usually because there's a collection of something in this space. So it's either going to be air or fluid. And so as there's more stuff in the space, then the lung is not going to have as much room to expand. So like now we have all of this filled up with whatever, right? And so now it just has this much room to expand. So that's why this person is short of breath and all of those things. So typically when they put a chest tube in, it's not going to be in the lung itself. It's going to be in this space, right? And so this chest tube is like draining all of this stuff out. So whether it's air or fluid or whatever, it's draining it out. And so every day that someone has the chest tube in, they're going to get a chest x-ray. And they're also going to monitor how much fluid or air is coming out of their chest tube. And so the chest tube is hooked to what we call an atrium. And the atrium has different sections to it. There's a section where the drainage goes into. There's a section that is hooked up to the suction on the wall. And there's a section that they call like the water seal chamber. So that's kind of just so you know what we're talking about here. All right, so just give me a guess and I'll explain more here in a minute. What would you pick?
D.
Would you say B?
D, yeah.
B?
D.
Oh, I thought you said B. I couldn't tell because I keep hearing something in the background. Okay, so you're going to do nothing because this says you have continuous gentle bubbling in the suction control chamber. So look down here. It says this gentle bubbling should be what you see in the suction control chamber. The bubbling should be continuous and not intermittent. So for A, increase the suction pressure so the bubbling becomes vigorous. No, you don't want to do that. That's going to make the water in the system evaporate, and that's going to be a problem. So C and D, chest tubes should only be clamped to check for an air leak or when changing devices. So you don't want to clamp. That's going to cause a big problem. Okay. All right, and then here's another chest tube one. So the nurse is assessing the functioning of the chest tube drainage system in a client with a hemothorax. So a hemothorax is the same thing as a pneumothorax. It just means that you have a collection of blood in that little space that I was just trying to draw for you. So which of the following findings should prompt the nurse to notify the physician? So let's look at these options here. Fluctuation of water in the tube in the water sealed chamber during inhalation and exhalation. So yeah, you're gonna see that. When they inhale and exhale, you're gonna see stuff go back and forth as they inhale and exhale. That's totally normal. Drainage system maintained below the client's chest. Yes, you would like to see that because if you have it up too high, it's not gonna drain right. That doesn't make sense. Drainage amount of 100 milliliters in the drainage collection chamber, and then occlusive dressing in place over the chest tube insertion site. So you always want an occlusive dressing because you don't want to have any air get under there because they already have, you know, too much stuff in this little space. You don't want to add to the problem, right? So which one do you think is correct?
C.
So typically, if you have 70 to 100 milliliters an hour, that's not normal. So usually you want it to be like a really small amount. You don't want to see a ton of it coming out at a time. And it varies, you know, depending on like some people will have a chest tube in after open heart surgery. And if you see a bunch come out, that's kind of a normal thing sometimes, depending on what's going on. So it just varies in person to person with that. Like in this though, we're talking about just someone with a hemothorax. So we wouldn't want to see a ton come out. Okay, if you are supervising a student nurse who's performing a tracheostomy care for a client, which of the following actions by the student would cause you to intervene? What do you think?
Would that be A?
Yep, you're right. So when you do tracheostomy care, a sterile field is set up and the sterile technique is required. So, you know, using universal precautions, that's not saying that you're using sterile technique, is what they're saying. Okay, a nurse is handling a client with a chest tube, another chest tube question. Suddenly the chest tube drainage system is accidentally disconnected. What is the most appropriate action for the nurse to take? So we already talked about we never want to clamp a chest tube, right? So what else would we do?
Is it the apply D?
So this is the thing with chest tubes, it matters where it's disconnected at. So if you have just like, say the chest tube's still in itself, but it's disconnected from the atrium, then that's a different story than if the whole thing came out of the person, right? So in here, it just says, suddenly the chest tube drainage system is accidentally disconnected. So to me, that sounds like it's just the drainage system is disconnected from the chest tube.
What would be A?
Secure it with the tape.
So believe it or not, it's going to be this. So
Place the end of the chest tube in a container.
read that rationale there.
If you check the fumes, the air container fills the insulation to prevent from entering.
Good, because I'm so mad at you.
So the idea here is if the chest tube is still in the person and it just came disconnected, you want to try to maintain that water seal. So by actually putting the end of it into a container of normal saline, it's maintaining the water seal. And it hopefully, if you do it quick enough, it'll do that before the lung fully collapses, right? Until you can like reconnect, you know, a new system to it. Now, if the chest tube itself came out completely from the patient, then D would have been correct. So if that's the case, you're worried, hey, this lung's collapsed now, you know, because the whole thing came out. So you would want to put, as you know, occlusive dressing over that and then notify the physician right away. Okay. So anyway, that's kind of how this goes. So some of the questions are okay, some of them are kind of weird sometimes, but for the most part, I think this is pretty good. All right, let me see. All right, I was looking through our Fundamentals ATI book, and I was just looking at the chapters, trying to figure out if there's anything that maybe you guys have not had before. If you guys have your book, look at chapter 15 real quick. Because I have a feeling that you probably have not had this stuff before. You guys there?
Yeah, we have to go grab it.
Okay, that's fine.
You said
So-
chapter
This chapter is called Security and Disaster Plans. And typically, like at school, when we talk about some of this stuff, we don't get into this stuff in fundamentals. We just don't. So like Intro to Clinical Nursing was supposed to be your equivalent to fundamentals. We don't talk about this stuff. So that's why I'm saying there's certain things in this book that, you know, could be fair game on your test. So you need to be reviewing certain things, okay? So in this chapter, it talks about like different emergency things that might happen and what you should do if that happens. So like one of the things in here, it talks about, you know, like if you're working and there's a tornado, you know, what do you do during that? Which a lot of you probably have to do that at work or whatever, so you probably know some of that. But like in here it says, hey, you're supposed to draw the shades and close the drapes because that's supposed to protect the patient from shattering glass that would come in. You are supposed to put the bed in the lowest position and move it away from the windows if you can. Like if they're close to the windows, you move it far away. And then you try to cover the patient in blankets. Because, you know, people that can't actually physically get up and get out of their bed, you cover them with blankets because if there's flying debris or whatever, the idea is hopefully it will, you know, save them from getting hurt. And then anyone who can actually get up and move, you would help them and like take them out of their room and put them in a, you know, a better place where they're not going to get hurt. So they say, take them into the hallway, away from the windows, or other secure location designated by the facility. So if there's somewhere where you can get them that kind of, how they always say to get in the middle of your house, or like if you had a basement, go to the basement or whatever. So obviously in a hospital setting, you can't do that. So you try and just get them away from the windows and the doors so they don't get hurt. You guys, I'm sure, are probably familiar with the whole fire stuff, because I'm sure you have to do that at your work. Now, you remember the race mnemonic? Do you guys remember that at all? Or did you ever learn that?
What?
The race mnemonic?
I think
Ari?
I do. Yes.
and then I forget about it.
Yeah, if you don't do it all the time, you forget, yeah. So anyway, that's in here. So that's part of the fire stuff, So the idea is rescue first. That's what the R is. A is the alarm. So you would, pull the alarm. C is contain. So you would, hopefully try to contain the fire. And then E is extinguish. So that's what race is. Other stuff in this chapter, it talks about like a mass casualty type of a thing. So like, I don't know, say heaven forbid we had an earthquake here in Ohio that was like super bad, and you worked at the hospital, or maybe you had to come to the hospital to help with the emergency plan or whatever. So it talks about triage and how you would say who was hurt the worst and who, needed immediate attention and all that kind of stuff. So that's in here. So I would definitely look at that. There is stuff about like biological weapons that people might use, like anthrax and botulism and the plague, like all these weird things. On page 79, there's a huge box that talks about like things that you might see if someone got exposed to that. So you remember, I forget how many years ago that was, but you remember when that was a thing where people kept trying to send anthrax to people in our government? Like they would get, a letter with all this white powder in it or whatever. So that was like a real thing not too long ago. So anyway, this kind of goes into like what kinds of things you might see if someone was exposed to it, how you can prevent it from happening, and then what you would do for treatment. So that's kind of important. I would take a look at that. That has to do with terrorism, unfortunately. Then also in here, they talk about stuff like a bomb threat. What would you do if you had a bomb threat at your work? And then an active shooter situation. Have you guys had to deal with any of that at your work, like where you have to get training on what to do for that stuff?
Yeah.
Okay, what do you remember about active shooter? What are you supposed to do with that?
I just remember that you're supposed to like go in a room where you can like barricade yourself,
Okay.
and then we didn't have like a lot of training on an active shooter yet. We had more training on like the bomb threats. They told us to like, if like they called, to keep them on the phone for as long as possible so that the police were able to like track their location or something like that to see where it was coming from.
Okay.
But yeah, for the active shooter, we haven't really had like a lot of training yet.
Okay.
Like,
How about the rest of you? Anyone else had that before? Okay, so with active shooters, what they say is that you're supposed to try and get away if you can. So you want to run away if you can. So they say evacuate if there's a clear path to an exit. Leave everything you have behind. Don't try and grab your phone or do anything else. Just leave. Get out of there. And instruct others to follow if they can. And then you're going to hide somewhere. So they want you to stay out of the shooter's sight and find some area where you can like barricade yourself in so they can't get in to hurt you. You want to silence phones or anything that's in there so that the shooter can't hear that. And then the last thing to do would be fight. So they say if you're unable to run or hide, and if danger is imminent, you're going to try to throw things at the shooter, yell, do whatever you can to help yourself. So the last thing you would do is fight. They say call 911 if possible. Not everyone can do that sometimes. Try to remain as calm as you can. Try to get wounded people out of there, and keep your hands visible if the police enter the area. Because even though the police are there to help you, they're always going to say, I need to see your hands or whatever, So always keep your hands up so they can tell that you're not, one of the bad people that they're trying to get, And then with the bomb thing, at my work, my old work, which I don't know if it says that in here. Yeah, it doesn't really say that. At my work, when I worked at SUMA, they used to tell us if there was a bomb threat, they used to actually have us like surveil our unit for it. So they would have someone looking up high, someone looking up like medium level, and then someone looking low in all areas. And they'd make you walk around and just look through stuff. And then if you saw anything suspicious, you would, say to someone to come take a look at it. But yeah, it was kind of scary. There was a certain thing that they would say over the loudspeaker if you had a bomb threat, so you would all know. But yeah, so if someone would call, you, like Christian was saying, you always want to see if you can identify any kind of anything that would help you tell the police who this person was or where they were at. So listen for any kind of sounds in the background. See if they have any kind of distinguishing voice characteristics or anything that would help you help the police more, And then other stuff in here talks about hazardous material incidents and also radiologic incidents. So this is a chapter I definitely want you to make sure you look at, because you haven't had this stuff yet, and you need to know some of these things. And who knows, maybe it'll be on your test, and then you'll be like, oh, I'm so glad Mrs. Silk told me to look at that, So make sure to look at this. The other thing I was going to tell you is chapter 16. So this is the health promotion and disease prevention chapter. And I know we all feel like we know a lot of this stuff, but I think you need refresher. In this chapter, it talks about like testing, like when you should get certain things done, like, oh, when should I get a cervical cancer screening? When should I get a visual screening? When should I get a digital rectal exam? That type of stuff. So I'm sure you know quite a bit of it, but there's probably some things that you need a refresher on. So look through this chapter. And then it talks about prevention. Have you guys, I'm pretty sure we talked about this on one of our classes before, about primary, secondary, and tertiary prevention. What's the difference between those?
Isn't primary before you get the disease, like what is it called? Like kind of like to prevent it from happening.
Yes. So primary would be more like, some of the examples of a primary intervention that you would do, it would be like immunizations, right? So if you get an immunization, then you're hopefully preventing that person from getting the disease or problem. So yes, that's an example of primary. What would secondary be?
Like you already have it?
Yes, you already have the disease. So what's our goal? What are we trying to do with a secondary intervention?
Treatment.
Yeah, so we're trying to treat the problem so that it doesn't get worse, right? So like some examples they have in here of secondary would be like an exercise program for older adults who are frail, early detection treatment of diabetes, so like if you identify that someone has diabetes, like do a lot of, treatment with them. Communicable disease screening, that would be another thing. And then what's tertiary?
Kind of preventing the sickness from getting, or kind of like keeping the patient comfortable, providing comfort.
Kinda. So tertiary is more about like preventing disability or what am I trying to say? The way they have it worded in here is you're trying to prevent long-term consequences of chronic illness or disability. So think of like rehab, you know? So some of the things they have for examples in here would be, you know, prevention of pressure ulcers after a spinal cord injury, um, referring to a support group or doing rehab, you know. So like if you're sending an older adult to rehab after they have their hip surgery, it's because you're trying to prevent them from having long-term disability, right? You want them to be as active and as functional as possible. So that's in this chapter too. And then they also talk about like Healthy People 2020. What is the purpose of that, you guys? Healthy People 2020. What is the purpose?
They talk about like health promotion, like healthy diet, providing health care to, what is it called? Low income population, stuff like that, like closing the disparity gap.
Okay. Were you going to say something, Vera?
Like preventing diseases and stuff too.
Okay. Yeah, so what they do is they identify problems basically that are around our country with health. You know, they look at things that are an issue and they try to focus in on that to see what they can do to make it better. So like, you know, maybe they look at, well, I'm trying to give you a good example. So like say they look at health disparities. Okay, so we talked about that before in class, what a health disparity is. So if someone has a health disparity, maybe it's because they don't have access to care. Then you try to figure out ways to give them access to care so they don't have that, you know? Or maybe it's because they don't understand well enough about things to do for their diabetes or something. That's why they have a disparity. So maybe you need to do more education, you know? So Healthy People 2020 is just trying to, their goal is to try and make everyone be able to live a healthier life and a longer life without disability and pain and illness and everything. That's kind of what their goal is. So every 10 years, they always go back and they like revamp it. Currently, they're revamping the 2031. They're trying to make that right now. So anyway, so what I want you guys to do then for future, for, you know, preparing for towards the end of the term, every week when you have a teeny bit of downtime, I want you to watch one of those videos on YouTube that I showed you. And I want you to take at least 1 or 2 chapters out of this fundamentals book and like really look into it and make sure you know that stuff. So maybe this week, or maybe this weekend even, you can look at chapter 15 and 16 and see if you can get that stuff down, make sure you know it well, and then, you know, we'll keep talking about it here and there throughout class or lab, and I'll keep checking in with you to see if there's anything else that we need to like really go over and make sure you understand better. So fundamentals, there's a ton of stuff in there. It's not just like all skills, you know. Skills are important and that's part of this, but a lot of this is assessment. So if you have a hard time with certain assessment things, you need to review that because that's going to be on here. A lot of this is the nursing process. So you need to make sure you understand that, like what the difference is between assess and diagnose and interventions and all of that. There's a lot in here. So in like some of the stuff, even like the last chapter of this book talks about your electrolytes, your fluid and electrolytes. And that's kind of going with what we are talking about for class this week. So that would be a good chapter to look at too. So just really take this seriously because I think you guys will surprise yourself. You'll probably do way better than you originally would have if you didn't, start really preparing for it like this, okay? So take it seriously and do well when we take this. Questions? I did put those drop boxes on Canvas. I don't know if anyone's looked since last class, but I went in and put those in. So if you have something to turn in for lab, please put it in there. They're there now, so you can do that.
There's
Yeah,
only
I
one,
think the only one is the airway
What's
that you
that?
can submit.
there's only one that has a submit thing on there.
I
and what-
created 3 things.
Yeah,
Yeah.
it's created, but it doesn't have the submission.
It doesn't have the box. Okay, I may
Yeah,
redo it then. There's a
the
couple
airway
of,
does though.
there's a couple of ways you can do it, and I must have to do it the one way because, all right, I'll fix it. All right, any other questions?
Yes, I have a question about the time. I wanted
Yes.
to see well, how much time we're gonna have for the exam next week.
So I asked, and they said, basically, I cannot change the time. So you are gonna have, I want to say it was like an hour and 5 minutes or an hour and 10 minutes, something like that for each test. So every test that you have has 60 questions, until we do the final, which will be a little bit longer. So the final will be longer. You'll have a little bit more time for the final. So get used to that time. So they're basically giving you like a minute per question, which honestly, if I had the ability to change that, I would, but I just don't. They won't let me. So be ready for that. And then remember, Monday, we're going to meet at 1. I will send you guys your tips to know, so you guys can start looking at that.
You said
Okay.
you send that today, or did you say you send the tips today?
I can't hear you, Vera. Say that one more time.
Did you say you would send the tips today?
Yeah, I'm going to try to. Yes.
Oh,
Okay.
okay. Thank you.
Anything else? Okay. And I will, maybe when I send you your tips, I'll also send you the Zoom invite for the thing on Monday that we're doing. Okay.
Okay.
All right, guys. Have a good weekend. I will see you later.
Bye.